Hi, I'm Steve Allder. I'm a doctor at Plymouth NHS Hospital Trust. I'm a neurologist and I'm involved in the changes that are happening across the health community in my role as Assistant Medical Director within the hospital. And in that role I have a lot of links with the commissioners and the plans to try and integrate the hospital more with community-based services. Healthcare spending has been going up and up and up for 60 years, and it's almost exactly the same in all developed countries. So there's something incredibly robust about the present system. And in the NHS, we've just gone through this period of immense growth, and that only stopped in 2010. So in many ways, why should the doctors and the clinicians at the moment be really worrying about this financial problem? I suspect that if you actually ask them to reflect on what's happened to them over the last 2 years, they're probably starting to notice that things are getting pretty tense. I can certainly say from my own experience in my own department and being in the hospital, the last 2 years have been really fraught, and if you look at going forward, it doesn't look as if it's going to get any easier. And that's the most important thing. You know, you can't force this stuff on people. You have to try and ask them to reflect, and if it genuinely feeds into a genuine concern they have, then they will sort of listen and be curious and interested. So when I probably started off with my journey in change, thinking about it, but I've just realised if you want to create genuine change, you want to create people on a journey, it only works if you tap into their authentic sense of meaning around this, and they will only do that is if what they see around them makes sense. And if their reality is not so bad, then why would they change? The simple truth is that all of the healthcare system is ultimately delivered through healthcare professionals. As a consequence, all of the expenditure is related to the behaviours of the people who deliver healthcare. So if you are really genuinely, seriously trying to improve quality and reduce cost, unless you are significantly changing the behaviour of all the clinicians in the system, then you'll fail. And there's no way that those clinicians are going to change their behaviour unless you engage with them and you explain really clearly what it is you want them to do and how it's different, and then you give them the opportunity to say, I agree, I really want to do that, and then you give them the skills to get on and do it. The lag time for prevention agenda is pretty significant, and preventing is hard. So I don't think there's very many examples of people who genuinely prevented disease happening. The stuff I was talking about is there's very good evidence for people taking existing problems and dealing with them in a much more effective way. Now, if you really genuinely want to get into prevention, then that's going to be a whole journey of discovery of, how do we tap into, our cultural beliefs about how we should live and interact with one another. And I think it's really exciting. But in the here and now, the prevention agenda is more, we have a population of people, we know they consistently get these symptoms, and we could manage those an awful lot better. In terms of, and I think sometimes people start thinking that that's a prevention agenda because it will mean that by getting their care better, we prevent stuff in the short, medium and long term. In my mind, prevention is like stopping obesity, or reducing the rate of obesity, reducing the rate of cardiovascular disease, and they are absolutely vital things that we do, but they're not going to help us in the short term with the financial challenge we've got now. Let's be clear that if you look at the NHS since 1948, it's never ever had to exist with more than 2 years of reduced funding. So the concept of having to do that perhaps for 3, 4, 5, 6 is completely unique, and this is a critical shift, and the only way we're going to navigate this is if we think about the work that we do differently.